Nmc Cbt questions and answer. Question number 701. Carpal tunnel syndrome is caused by compression of which nerve? Option A is median nerve. Option B axillary nerve. Option C ulnar nerve. Option D is radial nerve. Correct answer is option A, median nerve. Question number 702. The most commonly injured carpal bone is? Option A, the scaphoid bone. Option B, the triquetral bone. Option C, the pisiform bone. And option D is the hamate bone. Answer is option A, the scaphoid bone. Question number 703. Client had fractured hand and being cared at home, requiring analgesia. The medication was prescribed under PGD. Which of the following statements are correct relating to this? Option A. A PGD can be delegated to a student nurse who can administer medication with supervision. Option B. PGD cannot be delegated to anyone. Option C. This type of prescription is not made under PGD. Option D is this can be delegated to another RN who can administer in view of competent person. The correct answer is option B. PGDs cannot be delegated to anyone. Question number 704. Patient is post-op of repair of tibia and fibula. Possible signs of compartment syndrome includes option A, numbness and tingling. Option B, cool dusky toes. Option C, pain. Option D, toe swelling. And option E, all of the above. The answer is option E, all of the above. Question number 705. A Chinese woman has been admitted with a fracture of wrist. When you are helping her undress, you notice some bruises on her back and abdomen of different ages. You want to talk to her, and what is your action? Option A, ask her husband about the bruises. Option B, ask her son or daughter to translate. Option C, arrange for interpreter to ask questions in private. And option D is do not carry an assessment and document. This is not possible as the client cannot speak English. Answer is option C, arrange for interpreter to ask questions in private. Question number 706. What is the clinical benefit of active ankle movements? Option A, to assist with circulation. Option B, to lower the risk of a DVT. Option C is to maintain joint strength. And option D is all of the above. The correct answer is option D, all of the above. Question number 707. During enteral feeding in adults, at what degree angle should the patient be nursed at to reduce the risk of reflux and aspiration? Option A, 25 degree. Option B, 35 degree. Option C, 45 degree. And option D, 55 degree. Correct answer is option C, 45 degree. Question number 708. What is the best way to prevent with receiving an enteral feeding from aspirating? Option A, lie them flat. Option B, sit them at least 45 degree angle. Option C, tell them to lie in their side. And option D, check their oxygen saturations. Answer is option B, sit them at least 45 degree angle. Approximately how many people in the UK are malnourished? Option A, 1 million. Option B, 3 million. Option C, 5 million. And option D, 7 million. The answer is option B, 3 million. Question number 710. How can patients who need assistance at meal times be identified? Option A, a red sticker. Option B, a color surveillance. Option C, a red tray. And option D, any of the above. The answer is option D, any of the above. Question number 711. Which of the following is no longer a recommended method of mouth care? Option A, chlorhexidine solution and foam sticks. Option B, sodium bicarbonate. Option C, normal saline mouthwash. And option D, glycerin and lemon swabs. Answer is option D, glycerin and lemon swabs. Question number 712. Which of the following is not a cause of gingival bleeding? Option A, lifestyle. Option B, vitamin deficiency. Option C, vigorous brushing of teeth. And option D, intake of blood thinning medication like warfarin, aspirin and heparin. The correct answer is option A, lifestyle. Question number 713. A patient is recovering from surgery, has been advanced from a clear diet to a full liquid diet. The patient is looking forward to the diet change because he has been bored with the clear liquid diet. The nurse should offer which full liquid item to the patient? Option A is a custard. Option B is a black tea. Option C, gelatin. And option D, ice pop. The correct answer is option A, custard. The nurse is preparing to change the parenteral nutrition solution bag and tubing. The patient's central venous line is located in the right subclavian vein. The nurse asks the client to take which essential action during the tubing change? Option A, take a deep breath, hold it and bear down. Option B, breathe normally. Option C, exhale slowly and evenly. And option D, turn the head to the right. The answer is option A, take a deep breath, hold it and bear down. A patient has been admitted for nutritional support and started receiving a hyperosmolar feed yesterday. He presents with a diarrhea but no pyrexia. What is the likely to be caused? Option A, an infection. Option B, food poisoning. Option C, being in hospital. And option D, the feed. Answer is option D, the feed. Question number 716. Which of the following medications are safe to be administered via a nasogastric tube? Option A, drugs that can be absorbed via this route can be crushed and given diluted or dissolved in 10 to 15 ml of water. Option B, enteric coated drugs to minimize the impact of gastric irritation. Option C, a cocktail of all medications mixed together to save time and prevent fluid overloading the patient. Option D, any drugs that can be crushed. The correct answer is option A, drugs that can be absorbed via this route can be crushed and given diluted or dissolved in 10 to 15 ml of water. Question number 717. Which of the following is an open-ended question? Option A, do you enjoy the activities in this care home? Option B, do you like the food in the ward? Option C, would you like me to take you out for a walk in the garden? And option D, what are your favorite activities in the home? The correct answer is option D, what are your favorite activities in the home? One of the government initiatives in promoting good healthy living is eating the right and balanced food. Which of the following can achieve this? Option A, 24/7 exercise program. Option B, 5-a-day fruits and vegetable portions. Option C, low calorie diet. And option D, high protein diet. The correct answer is option B, 5-a-day fruits and vegetable portions. Question number 719. Enteral feeding patient checks patency of tube placement by. Choose two correct answers. Option A, pulling on the tube and then pushing it back in place. Option B, aspirating gastric juice and then checking for pH equal to or less than 5.5. Option C, infusing water or air and listening for gargles. And option D, X-ray. The correct answer is option B and D. Option B, aspirating gastric juice and then checking for pH equal to or less than 5.5. And option D is X-ray. Question number 720. What specifically do you need to monitor to avoid complications and ensure optimal nutritional status in patients being enterally fed? Option A, blood glucose level, full blood count, stomach size and body weight. Option B, eyesight, hearing, full blood count, lung function and stomach size. Option C, acid swallowing, patient choice, fluid balance, capillary refill time. And option D, daily urinalysis, ECG, protein levels and arterial pressure. The answer is option A, blood glucose levels, full blood count, stomach size and body weight. Question number 721. Our client breathes slowly and looks upward when listening to the nurse. Which sensory modes the nurse plan to use with this client? Option A, auditory. Option B, kinesthetic. Option C, touch. And option D, visual. The correct answer is option C, touch. Question number 722. Which check do you need to carry out every time before setting up a routine enteral feed via a nasogastric tube? Option A, that when flushed with the red juice can be seen when the tube is aspirated. Option B, that air cannot be heard rushing into the lung by doing the OPS test. Option C, that the pH of gastric aspirate is less than 5.5 and the measurement on the NG tube is the same length as the time insertion. Option D, abdominal X-ray. The correct answer is option C, that the pH of gastric aspirate is less than 5.5 and the measurement on the NG tube is the same length as the time insertion. Question number 723. An overall risk of malnutrition of 2 or higher signifies option A, low risk of malnutrition, option B, medium risk of malnutrition, and option C, high risk of malnutrition. The answer is option C, high risk of malnutrition. Question number 724. What factors are essential in demonstrating supportive communication to patients? Option A, listening, clarifying the concern and feeling of the patient using open questions. Option B, listening, clarifying the physical needs of the patient using closed questions. Option C, listening, clarifying the physical needs of the patient using open questions. And option D, listening, reflecting the patient concern and providing a solution. The correct answer is option A, listening, clarifying the concerns and feelings of the patient using open questions. Question number 725. Which of the steps is not involved in Tuckman's group formation theory? Option A, accepting. Option B, norming. Option C, storming. And option D, forming. The correct answer is option A, accepting.